Someone who is. It's important to know about pelvic health and how it can help with labor, delivery, and beyond. With more details is physical therapist Jamie Griffin with Hartford Healthcare Rehabilitation in Milford. Jamie, thanks for being with us.
Thank you very much. How are you today?
I'm doing great. Great to be here with you. Tell us more about pelvic health. Why is it important?
So pelvic health is such an integral part in helping female reproductive system both prenatally and postpartum. It's such a unique system that's unlike anywhere else in the body and has three very specific functions. So this is my pelvic model, this being the front and this being the back. And this system works three different ways: as sphincterically, sexually, and also as a sling to hold our internal organs in. So unlike anything else, the three functions make it so different to work with, train, and help when recovering or going through a labor and delivery.
All right. What should someone pregnant expect when they schedule an appointment with you?
Individualized treatment is the biggest thing that needs to be hammered home to any woman going through this right now. Just because you have peeing while you exert yourself or you have some pain doesn't mean that you should get the same exercises as another pregnant woman going through the same thing who have a more difficult pregnancy. You might have an easier one. So as much individualized treatment is the biggest part of making this process work for somebody.
All right. So, Jamie, you're a physical therapist. What are some exercises you recommend? And I understand that it really does depend on the patient.
Yeah, and I would say it also depends prenatal versus postpartum. When we work with somebody who is about to deliver, we work on both the pelvic floor and the spine to help prepare them for the labor and delivery process. We teach them some stretching of the perineum, which is down in this area here, to prevent any excessive tearing or even injury post-delivery. And then we do some stretching of child's pose, which is a really common yoga pose, some breathing to help to relax the pelvic floor so that it's less strenuous when you're passing the baby and delivering. And then we work postpartum to help those things as well. You might become tight, you might become painful after delivery, and using some of the same stuff pre might be helpful post as well.
And speaking of post, talk about some of what you do after the baby's born that women might need.
It really depends on the type of delivery, whether it's a straight vaginal delivery or a C-section. So if somebody has a C-section, you have some trauma to your abdominal wall, which a vaginal delivery wouldn't have. So we work with them on some scar mobilization. We help them to coordinate their muscles again because we are cutting through them in a C-section. And it's a progressive program that usually takes about 8 to 12 weeks. And then if you have, kind of your standard delivery, you're not even able to return to exercise until at least 6 weeks post-delivery. So we want to help set them up for some strengthening and abdominal work that will help their recovery just go that much smoother.
And quick last question, Jamie, is this something that women might want to ask their OB/GYN about, is talking to a physical therapist like yourself?
Sure. What's great about physical therapy in Connecticut is there's so many different ways of actually accessing it. You can talk to your OB/GYN, you can talk to your primary care physician, and then also we have direct access in the state where you don't need a prescription and can be seen covered by your insurance for a certain amount of visits.
All right. Did not know that. All right. Physical therapist Jamie Griffin with Hartford Healthcare Rehabilitation Network in Milford. Thank you for all the information.
Welcome. Nice talking to you.